names in the middle.
Well, hello, Soror Dearline. Thank you so much for joining me tonight. This is our second Breast Cancer Awareness Live Facebook event, and I'm so excited that we are back here again. We're in a new sorority year, so many great things happening within Zeta Phi Beta Sorority Incorporated that we really can't keep up with it all, and I love it that way. A lot of royal blue takeovers occurring right now. And we just have a lot going on in this 102nd year of our existence. We even have a new international president. So we are excited to be serving under Dr. Stacey N.C. Grant. And you are looking absolutely captivating tonight, which makes sense because we are the captivating Chi Theta Zeta chapter of Zeta Phi Beta Sorority Incorporated. And we have so many national initiatives, but tonight our vision or our focus is on that of our national partnership with the American Cancer Society. And this breast cancer awareness talk ties into our efforts to support making strides against breast cancer and just getting that awareness out to the community. In addition to our efforts with making strides against breast cancer, we also have Relay for Life that addresses cancer, the Hope Lodge, Real Men Wear Pink, and then we also have awareness efforts for triple negative breast cancer. So tonight we'll be talking, sharing a lot of great information, hopefully to benefit our community. And hopefully our chapters on and tied in, and we're thankful for them assisting our efforts tonight to be successful. Of course, we are led by our great chapter president, Kimberly Berry, who always gives us finer leadership and encourages such events as we are doing tonight. So are you ready to share some helpful information with the community that will hopefully impact everyday lives and help people learn more about breast cancer awareness?
Good evening, my sister. I am always happy to share helpful health information with all those in my community, as my passion has always been to empower not only myself, but empower family members, friends, anyone that I come in contact. They know that I have a passion for people, and I have a passion to empower people to be their best selves by equipping them to make wise decisions, or should I say well-informed decisions about their health care, as well as being advocates in their own health care. And so I'm always happy to share.
Great. I think that embodies you very well. I just love serving by you as we do our best to serve Tallahassee with kindness and sisterly love. If you could, let's start off by sharing your credentials.
All righty, thank you. Well, I'll introduce to some and just say hello to others, but I am Dearline Thomas Brown, MPH BSN RN. So I hold a master's in public health from the Florida Agricultural and Mechanical University's Institute of Public Health. I am also a Bachelor of Science in Nursing graduate of Florida A&M School of Nursing. I won't say what class because that dates me, but I have been in the nursing field well over 30 years, serving the Tallahassee community for over 19 years, and been loving every minute of it. So I'll just say that being a public health nurse was the niche I found in nursing school, because it allowed me to meet people where they are, to provide them what they need where they are, and to be a help in a time of need. And even when they didn't think they needed it, we were a help. And so I'll just say being able to share the breast cancer information is one of my loves. I used to serve as the breast and cervical cancer early detection nurse in Leon County many moons back. when the program was a little bit new. And this was the time when we had to literally go and do outreach in the community. We had to put our flyers in the beauty shops, in the barber shops, in the pharmacies, in the grocery stores, at the churches, the gas stations, anywhere a young lady may go that may or may not have health insurance. And so we had to introduce that program to the community. And believe it or not, it's just not just a local program or a state program. It's actually a national program. And we'll talk a little bit more in depth about that program, definitely for those who need it or for those who know someone who would need it.
Okay, thank you. And I will introduce myself as Sora Natasha Wilson. I am not in the medical field. I am in that of information technology. I am from Tallahassee, and not being in the medical field, but understanding the importance of being aware of breast cancer and um, joining your passion or sharing your passion for wanting to make sure that women in our community and men, because
Mhm.
they can have
Amen.
breast cancer too.
Yes.
It's very important. I myself am thankful for nurses and those in the medical field, as when I was in high school, I had someone such as yourself, similar to yourself, come out and teach us about self breast exams.
Mhm.
And I found my first benign, thank God, lump in my breast by that practice. And I've always been attuned to breast cancer awareness from that day forward. So, what is important for people to know about breast cancer?
Well, the most important thing to know is that breast cancer is one of the most common cancers in American women, with the exception of skin cancer. And it can account for 1 in 3 cancers diagnosed in women. Now, believe it or not, men can develop breast cancer too.
Mm,
Anyone who has a chest cavity or who has the mammary glands, men and women, can develop breast cancer.
yeah.
Although it's little less common in men, it still can happen. It still can develop. And
Mm,
so, if you or your loved one or anyone in your family or friends that you know that have been diagnosed with breast cancer, the first thing you want to do is not educate yourself and then share that information with those in your family. And now, if you've been diagnosed, it's really important that you share with your family members because it can be hereditary.
mm,
Uh, and so, mothers share with your daughters, aunties share with your daughters, your nieces, grandmothers share with all the women in your family because breast cancer can be hereditary. And I can share a personal story where all the women on my father's side of the family have developed breast cancer. So
mm.
there is a chance that I could. Of course, I'm gonna do everything I can
Of
if
course.
God willing, to maintain my health, so that if it does occur, that I'm in my body's in a good place to be able to fight it. Now, I will explain this. Everybody has genes and has cells in their body. That's what's the makeup of our body. And what people may not understand about cancer cells, a cancer cell is a normal cell that refuses its life cycle. Cells are created, fulfill their purpose, they die, and they're absorbed by the body. A cancer cell refuses that life cycle, and what it does is it becomes radical. So that's where you hear the term radical.
Yeah.
It refuses its life cycle. It then encroaches on other cells because now it's trying to gain their life source in order to continue to survive, spread, and grow, kind of like a virus. And so, really, it's a radical cell. They're called oncogenes. We
Mhm.
all have them, and it's just a matter of when and if they're going to turn on, when and if they're going to become radical. And our bodies kind of set up that environment for us, depending on the status of our health at the time of diagnosis.
Wow. And hearing you say that it's hereditary is the perfect segue for our next question, which is, when should one start screening for breast cancer? Because we all know early detection is key, right?
Yes.
If we
Yes.
have to experience it, we want to detect it early so we have a better chance of attacking, fighting, and alleviating the disease.
Mhm.
So when should one begin screening for breast cancer?
Well, there's different ways to screen. And first of all, just know, as soon as a young lady gets her cycle, she needs to start checking her breasts. The same
Okay.
way with young men, they don't get a cycle, but as soon as they start going through puberty, they need to check for two things. They need to not only check their chest for lumps or nodules, their underarms for lumps and nodules, but they also need to check their testicles for lumps and nodules, because what people don't understand is testicular cancer can affect a young man as early as the age of 19. And
Wow.
so with breast cancer, women, young women, once they start getting their cycle, 5 days after their cycle, if they get to know their breast tissue, they're the first to know when it changes. So that's the first step, is teaching that. And I'm so glad you said you had a nurse to come out and teach you when
Yes.
you were in school, because
Yes.
we do have some young women who mature a little faster than others,
Mhm.
due to our environment and some of the steroids in our environment. And then sometimes it's hereditary, where they're predisposed for having larger breasts, or for having development a little bit early. And so for those who don't have a family history,
Mhm.
it's okay to check it. And I'll say this: anyone who has breasts, including men, as soon as you start going through puberty, it's okay to start doing your self breast exam, so that
Yeah.
you know when that tissue changes.
Mhm.
Then you'll start going to the doctor when you get your well woman or well man exam. And for well women, we normally get our breast checked by our provider during
Yeah.
that well woman exam. And
Mhm.
then they'll teach you how to do it and ask you, you know, uh, how often do you do it? And of course, once a month is adequate. But those of us who don't have a cycle anymore, we want to check it like the day of our birthday. Like my birthday is September 19th. So on the 19th of every month, I
Mhm.
would check my breast when I no longer have a cycle, just for lumps or anything. Now, as far as getting mammograms or having ultrasounds, the textbook normal is usually around the age of 40, unless there is a family history, and
Right.
especially a direct family lineage line, where your mom, your sister, your aunt,
Yeah.
your grandmother, if any of those women in your direct line have been diagnosed with breast cancer, then your practitioner, if you know and that's why it's so important to know your family health history. If you know that family health history, you can let your practitioner know, and they can start making those appointments a little earlier, and justifying with your insurance company why they need to pay for it at an earlier age than 40, because some women develop it at 35. And so it all depends on that genealogical, that depends on the genetics. And so
Right. And
the optimum is between 35 and 40.
mhm.
And then for those of us, when we start going through these premenopausal, postmenopausal, menopausal changes, that also
Yeah.
causes those breast tissue to change, and the density and things and changes. And I'll say
Mhm.
it the way an OBGYN I used to work for says. He says, you need to get to know your lumpy bumpiness, so you're the first to know when it changes.
Yeah.
And then
Makes
he
sense.
and he would ask ladies, do you experience breast tenderness before, during, or after your cycle? And most of the time they would say, oh, it's either during or after, or before. And then he would ask them, do you take in excessive amounts of coffee and chocolate, coffee, or tea? And they're like,
Mhm.
I'm a chocoholic. And it's usually because your body starts to crave that caffeine around that time. Well,
Yeah.
that increased caffeine can also increase your tenderness and soreness to your breast tissue. So it actually it can actually stimulate those lymph nodes. It stimulates those lymph nodes, and they get a little tender. And so you'll start to feel it during that time of the month, because your body kind of craves that time of the month, because
Right.
that's also one of the things that helps alleviate your period pain, is
Yeah.
caffeine with your
And I
with
think
your pain things.
really great that you gave the example of using your birthday when you're
Oh
no longer
yeah.
having a cycle to remember, because one thing we know about any habit is that making it convenient and incorporating it into something that we're already familiar with,
Doing
helps.
just like
And
brushing
then
your teeth.
just like brushing your teeth. And I do remember one bit of advice, and I'll ask you to speak to if it still stands true, was that it's helpful for young ladies to do their breast examination in the shower,
Yes.
and kind of like habit stacking. This isn't something that you have to set aside a special time to do. You can just do it while you're in the shower, right? And it's super convenient.
Super convenient. And not only that, key points are you look in the mirror every morning. You need to look at those breasts every morning because you need to see if they're symmetrical, asymmetrical, if there's any dimpling or puckering in the skin. So you need to look at them. It's okay, they're
Right.
yours.
They're
You
yours.
also, yes, a good time to check is when you're in the mirror, in the shower, when your skin is a little more slicker in that warm water, you can feel your lymph nodes a little bit better. And then before you go to bed, when you lay down, because when you lay down, tissue moves. Some things may move out the way that you didn't feel while you were standing up, because you know gravity has a way of doing things. Then you also want to check when you're laying down with one arm over your shoulder, which is what your doctor does or your provider does when you go in once a year for that breast exam. If you notice, they always check your breast while you're laying down. And
Yes.
they do that because then that tissue kind of spreads out a little more and you can get a little better feel. And so you definitely want to do the self breast exam. If your doctor says you need a mammogram, get it done. Don't
Yes.
procrastinate. Don't be afraid of, because a lot of folks are afraid of what they're going to find. You always want them to find anything when it's the size of the head of a pencil and not the size of a golf ball or tennis ball.
Right. Early
Because
detection
early
is
detection,
key.
early cure, and usually they can alleviate it with sometimes with or without radiation or chemotherapy, depending on whether they can excise all the tissue that is affected.
Right.
Even if you have a mammogram and they come back and say, we need to do an ultrasound, don't get alarmed.
Right.
As we mature, I hate to use the term age because cheese ages, but people mature. As we mature and become seasoned, our bodies change. And so does the lumpy bumpiness of our breasts. Sometimes they can become more dense. And what I mean by that is those nodules underneath, when you're young, that's what allows them to stand up and sit up. When you get seasoned, they kind of start to drop because
That
gravity,
gravity matters. Gravity
gravity
matters.
does it, gravity matters. And so, and it also, when gravity matters, it also makes it a little bit harder for you to check sometimes, which is why you have to do the different positions. But the MRIs, the ultrasounds, and the mammograms are key factors for checking and making sure that that lumpy bumpiness or whatever they think they might see, if it really is a growth, if it really is a nodule or a fluid-filled cyst, it gives them a better picture of what they're looking at so that they can make a better determination of what you need or don't need. And so
Right.
don't be afraid, go back. Sometimes for some of us, and I'll give an example of me, the first time I had to go back for an ultrasound, I was like, what y'all saw? And then I said, you know what, God, I'm gonna put this in your hands. Whatever they saw, they needed to see it, and they see it early enough because this is the first time I'm having to go back.
Right.
And I'm gonna make y'all laugh. It was a pocket of fat. And so as we get seasoned, things change and things shift. And so
Right.
don't always think the worst. Sometimes it's simple, a
Right.
fluid filled cyst that reabsorbed by the body. Sometimes it's a pocket of fat. As we mature, we gain a little more fat cells, and yeah, they can develop there too.
Right.
And so
Right.
you always want to get it checked out. When in doubt, get it checked out. If you ever feel a lump that feels like a marble or a pea or something that's hard, whether it's movable or not, get it checked out because you always
Right.
want to know for sure what it is. And so, of course, women at age 40, 35 to 40, who have a family history of breast cancer. Then, of course, the CDC recommends annual mammograms for women ages 45 to 54 or 45 to 64, really 45 and up.
Yeah.
And then mammograms every 2 years for women 55 and older who have had regular screenings over the years without any issue and have not had any detection or any changes to their lumpy bumpiness, which means that they've always been benign. And then, but you have a choice. If you know you have a family history, even if it's a distant family, you have a
Yeah.
choice to get it every year. And
Yeah.
so for African American females, I would say get it every year because a lot of times by the time they find ours, if it's real aggressive, that 2 years can mean a lot. And so
Right.
make sure, for those that are at high risk, that you get that MRI. And I'll put it this way, the MRI and the ultrasound are nothing compared to the mammogram.
Mm,
So if they say you need an MRI, get it.
do
It
it.
don't hurt. If they say
Right.
you need an ultrasound, get it. It don't hurt. The mammogram can be a little uncomfortable.
Just uncomfortable,
Those
that's
are the
it.
terms that they use. It can be a little
A
uncomfortable,
little
uh,
uncomfortable.
but get it done anyway. Now, I will say this, ladies, if you're in the STEM industry, come up with a better way. Come up with a better way,
Come up with a
so
better
that
way.
it doesn't have to be uncomfortable.
Right. And I told women, and don't let that idea of it being uncomfortable deter you, because we can do hard things and we can tolerate a bit. You're uncomfortable for a very short period of time. And
Well,
so just go ahead.
I'll put it this way. It's more comfortable than having a biopsy.
There you go. Very, very good point. Very good point. And so kind of just tying things together, you let us know what breast cancer is, when we should start our screenings. We've talked about, in this instance, the old adage of "I rather not know" need not apply. We want to know, the sooner the better.
The sooner the better.
Right. But in the event we should receive a breast cancer diagnosis, what's next?
Okay. You always want to make sure that you talk to your oncologist. Make sure you have a good relationship with your oncologist. Find out what all options are. Find out what type of breast cancer you have, because there are many types. There are different types of breast cancer. And so you want to see what your options are. Because of the changes, or should I say the advances to medicine, breast cancer is no longer as we call it, the death sentence that it used to be. And so with that, you want to make sure that, like we said, early detection, early cure, find out what your options are, find out where those options are, because sometimes you may have to go somewhere else outside of your city. But I'm so grateful that we have a, what is the word, magnet and state of the art cancer centers here in Tallahassee. So we don't always have to go to Shands in Jacksonville or go to the cancer center up in Atlanta. We actually have a reputable cancer center right here in our backyard over at TMH. And so you want to find out the type of cancer you have, and you also want to find out, what treatments are available. With so many advances, it used to be chemotherapy, radiation, that was it. And then, mastectomy. Now, we know that there are different genes, and some women are opting to have double mastectomies if they have that gene that determines that they're going to develop breast cancer, and they want to get to it early. And so sometimes some women opt to have the double mastectomy in advance as a, I hate to say prophylactically, but technically that's what it is. They're doing it to prevent the development of that. And so the different types of cancer can be, invasive ductal carcinoma, which begins in the ducts and other parts of the breast, and then it becomes invasive, means that's when it starts to spread. And then there's lobular carcinoma.
That's what we don't want. Tying back to early detection.
Right. And then there's lobular carcinoma, where it begins in the lobules of the breast tissue, and then it invades the tissue, nearby. And so anytime you hear the word invasive, that means it's spread, but that does not mean it has spread to all over your body. And so then you have ductal carcinoma, and that affects the ducts, or the ducts in the lining of the breast tissue. And so, symptoms are usually like a lump or swelling in the breast. Sometimes it's redness or flaky in the skin or skin tissue. Sometimes irritation or dimpling. And sometimes it could look like a rash. And then for women who either have never breastfed or they stopped breastfeeding 50 years ago, if they start to have nipple discharge, that's a key figure that something is not right. And then, of course, sometimes there's a pulling in the nipple or pain in the nipple area that's normal, that it's not like you you got it caught on something, it just starts to hurt for no reason. And then you have all the different genetic mutations. You know, you've heard them say the BRCA1, the BRCA2, the HER2, HER2 negative,
Yeah.
HER2 positive. You've heard that in some of the commercials lately. And then, of course, there's also what's called triple negative breast cancer. And in triple negative breast cancer, it's a kind of breast cancer that does not have any of the receptors that's commonly found in breast cancer. And so if you think of it in this way, of cancer cells as a house, the front door has three kinds of locks called receptors. And so one is for a female hormone receptor, which is estrogen, which we have in our bodies. One is also for the other female hormone of progesterone, and those fluctuate when you're, during your cycle. They also fluctuate when you're pregnant. And then there's another another one that's a protein called the human epidermal growth factor, which is HER or HER2. And so if your cancer is any of these, these three locks, then doctors have a few key ways like hormone therapy or immunotherapy, where they can use these drugs to destroy the cancer cells. And sometimes that means you may or may not have to have surgery. But if you have triple negative, it means that those three locks are likely not there. So the doctors have fewer ways to treat the triple negative breast cancer because those three locks are missing.
Right.
And so unfortunately fortunately, chemotherapy and radiation are still an option for that,
Right.
for the triple negative. Okay. And then of course, for some, a lumpectomy. You may not have to have a whole mastectomy. You can get a lumpectomy, which removes that lump from the breast. And they also will remove, lymph nodes and stuff that are nearby, which are those oval shaped organs, the lymph nodes that actually spread all over your body. And so they usually can do a lumpectomy first. And that can determine if the breast cancer has spread. And then for those who it's beyond the size of, I would say, maybe a golf ball or tennis ball, then they may recommend a mastectomy, depending on the size of your breast. And then if they do a mastectomy, women often can choose to have breast reconstruction during that same surgery. So when they come out of surgery, they're not flat chested. They come out of surgery with a new pair, should I say. And then there's also radiation and chemotherapy. And of course, the radiation takes about 20 minutes. And it's where they use radiation, high energy radiation, to kill those cancer cells in the breast. And then of course, chemotherapy is usually given through an IV. And so it's where, chemically, those chemicals are used to kind of help destroy those cancer cells.
Thank you for
yeah.
covering the types, and then also some of the forms of the treatments. And I could only imagine that when you first hear the words, you have breast cancer, what a shock that would be to most women.
Yes.
Is there any, I guess, in talking to your oncologist or primary healthcare physician, do they encourage women to seek second opinions, as well as maybe counseling or support groups, so that they're not going through this alone?
Always. And so usually your doctors will provide you, they'll sometimes their second opinion is in there with you. So everybody's talking to you usually. And depending on where you go, sometimes there's a team that's looking at your case and they're sharing with you what your options are. Now, what a lot of people don't know, of course, until they're diagnosed with cancer, is the American Cancer Society has support groups, but they also have support peers, which are individuals who have gone through breast cancer, the different types of cancer, and they sometimes will come out and help ladies as well as men. And so for women who've had a double mastectomy, they'll come out, they'll come and help you after surgery. They'll come while you're in the hospital to introduce themselves to you, share their story, and then share with you some of the benefits that are available through the American Cancer Society, which is why it's so worthwhile to donate. They can help you find wigs if you've lost your hair. They can help bring bras to you that will help during your, after your mastectomy and before you get your breast augmentation surgery if you have to wait. Sometimes you have to wait to get it depending on the type of cancer you have and how invasive it is, or the condition of your body at the time of surgery may not be able to go through both at the same time. And so they can come and they can help you with any questions that you have. They will actually come and drive you to some of your follow-up appointments, and they will at you, they'll be there for you. They can be a good companion for you, and because they've been through it, they can tell you what to expect, and and what things are available, and they can also help get those things to you and help get you to the services that you need. And so American Cancer Society has a lot of those services within their realm and within their reach. And then, of course, in the medical field, you have your clinicians, and then you have peer counselors also in the hospital, and you have nurse case managers, and you have social workers that help coordinate those services on your behalf once they know what you need. And a lot of times, if you have an insurance company that does what we call the uh, social determinants of health, they're looking at not only your health diagnosis, they're looking at your overall what you need, if you need food, if you need transportation,
Awesome.
and
Like a
things like
holistic
that. The
approach, making
holistic
sure
approach. If you need
everything.
groceries because you've been going to chemotherapy 3 times a week, you haven't had time to go to the grocery store because when you leave chemotherapy, you're exhausted. And so they will, they can offer you frozen meals to be delivered to your home and things like that to kind of help you during that process.
Awesome. That thank you for sharing that. That really drives home how the donations to the American Cancer Society are put to good use and really help women, you know, uh, survive through this.
Yep.
That's
Help
what we
women and
really. That's
men.
what we really want, right? We
Mhm.
want
Oh yeah.
everybody to be survivors on the other side, and just so we can. We don't want to leave the discussion on, a down note, talking about you've been diagnosed.
Mhm.
Basically, we told them to have their breast examinations and early detection is best. Just because they discover a cyst in their breast, it's not an indicator that they will have breast cancer eventually. Or let me rephrase it in the form of a question. If a young lady should find a cyst in her breast, is it an indicator that she will eventually have breast cancer?
Everybody's body is different. Everybody's body develops things in different ways. Sometimes a simple cyst can develop out of nowhere and it has nothing to do with breast cancer. Um,
Right.
if
Awesome.
the same way we develop moles and stuff on our face, nobody knows when they're going to come, if they fall off, if they're coming back, things like that. And so everybody's body is different, and so
Right.
we can't, there's no catch-all for what the likelihood of developing breast cancer, lung
Right.
cancer, cervical cancer, the different types of cancer. And like I said, it's basically the status of your health at the time of infection, the status of your health at the time of diagnosis. And so being as healthy as you possibly can and being positive makes a difference, because
Yeah.
negativity in your body, as we say, dis-ease becomes disease. So you want to minimize your stress. You want to eat as healthy as you possibly can, reduce your salt, sugar, and fat. You want to get active, because if you're already living a healthy lifestyle at the time of diagnosis, you have the best chance, especially
Yeah.
early diagnosis. You have some of the best, opportunities, because your body is kind of like at optimum functioning. Even though that oncogene refuses its life cycle, it can be eradicated.
Right. And really what we want them to take away from tonight is, should they discover the lump, the cyst, immediately go talk to
Go.
someone. Right.
Go to your
And
primary care provider. Insist on getting referred to an oncologist if you're in an HMO or PPO, because those are your gatekeepers. Insist on being referred to the top oncology provider in your area. Insist on what are the best treatments for the best outcome. Does my insurance cover it? If they don't, what if I have this catastrophic? Some people have this little cancer policy that they forget about, especially at the time of diagnosis, because at the time of diagnosis, your mind goes blank. You
I could only
hear,
imagine.
after you hear you have cancer, everything else sounds like Charlie Brown's teacher, want,
Mm,
because you have tuned out everything else. And until you can get to a place where you can hear, okay, this is not the end. Okay, I have been diagnosed with cancer. What are my options? What do we need to do? What's my next step?
right. Thank you. Thank
Because
you. That,
again, it does not, it does not have to be the death sentence it used to be. It's all in what you do, what you have
mhm,
access to, and access to care is key. And yes, be your own advocate. Tell them, I want the best. Where is the best, and how can I get it?
awesome. Now, and that question was from our chat. So we do have people tuned in,
Oh,
watching and
great.
asking questions. There is another one. It's I think more education about fibrocystic breast and period timing would be important. Can you speak to that?
Well, as I said, the fibrocystics, that's the lumpy bumpiness of your breast. And as young women, it allows them to sit up so you got perky ones. And as you get and as you get more mature, and you lose your little bit of your perkiness and those and
Because gravity
everything and
matters.
everything and gravity matters, everything changes. And you also want to make sure you get your well woman exam, because then they can start looking, they can start doing ultrasounds earlier to check your fibrocystic breast disease, because that can also be a key factor in whether in determining, or I should say, in whether or not you develop breast cancer early or late or never. And so just because you have fibrocystic breast disease does not always determine that you're going to have breast cancer. Some women have fibrocystic breast disease and never develop
Yeah.
breast cancer. It just all depends, again, on the status of your health.
Yeah. Well, thank you so much, Sora Darlene Thomas Brown, for all of the information that you shared tonight. Is there anything additional, as I have completed all of my questions and we do not have any additional questions in the chat? Is there anything else you would like to share with the community about breast cancer?
Yes. Well, first and foremost, for those who have insurance, see what your insurance covers. For those who don't have insurance, or who were considered underinsured or uninsured, there's a breast cancer early detection program at your county health department. All 67 counties in the state of Florida have this program. And for women who are 50 to 64 that don't have health insurance, you can actually enroll in this program. You can get your annual mammogram. You can get your well woman exam. And if you're diagnosed with breast cancer or cervical cancer, they will then assist you into getting Medicaid, which will help you then pay for your services. That Medicaid will also pay for transportation to get you to and from your doctor's visits. It'll help pay for chemotherapy, radiation therapy. And here in Florida, currently, Humana has the state Medicaid program. And under that plan, it also allows, in addition to the transportation, it also allows those that food when you come out of the hospital to be delivered to your home. It helps you get your medicine delivered to your home through Centerwell Pharmacy. It also provides a lot of other options for those for the Medicaid population, such as vision and hearing. It also allows different types of treatment. And of
Wow.
course, as Medicaid recipients, you don't have a copay. You don't have an out-of-pocket expense. And so it then connects you to your surgeon. It also connects you to resources that if you're uninsured or underinsured, you might not know about. When I was the breast and cervical cancer early detection program nurse, I had 3 facilities I was able to send my ladies to get their mammograms. And when the Sharon Walker Ewing Center opened up at TMH, a lot of my ladies was like, "Oh, I like to go there. I like to go there." Now, it's no shade on my other facilities, but when a facility takes the time to put you in a cloth robe when they have
Mhm.
comfort warming pads on the mammogram table, when you have you have technicians that are very gingerly sensitive to you,
Okay.
and you might get a little chocolate on the way out.
Sounds
Every little
like
bit
the experience.
helps. and
Yeah,
so and so they do things to try to make that experience a little more palatable.
okay.
And so
Well, that
I
sounds
will
like a
say that.
very beneficial and comprehensive plan, resource. Maybe we can get together and share that information and have something posted to our Chi Theta Zeta Facebook page
Definitely.
for everyone to reference later.
And
Well,
also,
again,
what we talked about American Cancer Society, they also help link individuals who may be under the age of 40 or under the age of 50 to, I'm trying to remember the program that they used to have for those women. It kind of filled in that gap for those who weren't quite old enough for Medicare, could not, and maybe were below 50 and developed breast cancer.
mhm.
If I think of it, it's not coming to me right now, but there was a program that we were able to refer them to, so that if they didn't meet that criteria, they were still able to get services after diagnosis.
Well, no
It'll,
problem when it
it'll
comes.
come to me once we get
When it
offline,
comes
I'm
to,
sure,
yes, and
as
we, like
always.
I said, we can go ahead and share the information via our Chi Theta Zeta Facebook page. And as we end tonight's live, I would just like to remind everyone that for additional information about cancer and breast cancer awareness, you can visit cancer.org, which is a website of the American Cancer Society, which can answer any additional questions and put you in contact with resources to further assist or educate you. So, Dearline Thomas Brown, I thank you. And this concludes our live for 2022. You
Thank you
have
for
a great
having
night.
me. Good
Yeah,
night.
and thank you everyone for watching. Good night.